good morning. Thank you so much for having me today. I will be your moderator for the first session. So who am I? My name is AudreyStephannie Maghiro. I graduated in college in 2019 with a degree in molecular and cellular biology and a minor in Spanish. After graduating, I went and became a missionary for 2 years and returned to Boston in 2021, last year, where I serve as the research coordinator at the Undiagnosed Diseases Network. So I don't know if many people know about the network, but the Undiagnosed Diseases Network is a research study that tries to improve access to diagnostic resources for patients who have had long odysseys for their medical conditions that still remain unsolved. So I like to think of it as, I like to think of it as we try to, leverage scientific resources, but also one of the biggest resources that we will also be talking about is the social health resource, which we use or we call the UDN PEER, which stands for the Patient Engagement and Empowerment Resource. So oftentimes, many people, either have gone through doctors who see something or do not understand what's going on behind the surface, and oftentimes that their patient care is limited to that network or that doctor's network. And so what the Undiagnosed Diseases Network attempts to do is basically to increase or expand that network, right? So maybe there's a doctor or a scientist or a clinician who has seen something similar in Washington, but if you are in Florida, you might not know, right? So the goal is to, hopefully, ask patients to, or their doctors to reach out to or apply for the network, and from there, hopefully begin them on a more, answering journey. So if you are like me, I did not know that I was participating in social health before Sarita, reached out to me. But that resource of the patient engagement and empowerment resource of utilizing social media, or maybe someone else who might be going through something similar to you with your own disease or condition, is something that I didn't know. So I really love Health Union's definition of what social health is, which is the dynamic real-time action people take to find meaningful connections and share information that impact the health journey. So again, PEER is one of the most grateful resources that I didn't even know about within the UDN, where patients can engage with our Facebook group or engage with the board members on PEER and say, hey, this is something that, my doctors are saying is a possibility. Can you tell me a little bit more about this? Or this is what we're seeing. Can you tell me more about this? And we've also had patients who, have gotten diagnoses or new conditions diagnosed based on someone seeing something similar within, themselves or their children, and saying, hey, we would like to, get our genome sequenced because it's our child, or we are presenting similar to what you said on your blog. So I think that this next panel is going to be so important and so fascinating if we, have the time to just go into that, which which we will, be doing in the next 2 minutes. So this next session is going to be called Utilizing Social Health Concepts to Transform Healthcare Solutions, right? And so to start us off on that conversation, we will be using, or we will be hearing from Sarah Coff and Kristine Zerkowski. And then afterwards, we will be having a fireside chat in which Ilana will be joining the conversation. So I will turn it over to them.
So good morning, I'm Kristine Zerkowski, and I'm here with my colleague, Sarah Coff. We're members of the community team at Health Union, and today we are representing Health Union Social Health Network. We're here to share some of our published research on social health, ways to leverage social health to increase impact of your advocacy, and we'll talk about some real life examples to get your wheels turning on how to apply it to your own patient leadership. Trudy, you can go to slide 2. Well, actually, you can go to slide 3 if that's all right. That's just us. All right. So for those of you who don't know Health Union, we believe that the voice of the personal experience from people impacted by complex health conditions is the most important voice in healthcare. Through the largest network of online health communities and patient leaders, we drive unique and impactful conversations about health that reach and engage people in the most important points of their journey. We currently have 40 communities, and we're growing, and all of those communities focus on different condition areas that you see on your screen now. And then in the middle, our newest community, the Social Health Network. So the goal of the Social Health Network is to support leaders across all health conditions. Instead of a health-specific focus for this new community, we have focused on health leaders. So we're meeting people where they are in their advocacy journey and helping them feel more empowered to share their voices and make an impact. Next slide, please. So the Social Health Network is a new community that just launched this past month. It's the result of Health Union's Ambassador Program, formerly called the Pillars Program, and We Go Health Patient Leader Network, coming together to create the ultimate health leader community. We focus on patients, caregivers, HCPs, and aim to bring the community resources, panels, events, and paid opportunities to increase your advocacy efforts. If you want to learn more, we'll be sharing links later in the presentation, but you can always go to socialhealthnetwork.com to sign up. Next slide, please. So before we jump into social health, I want to talk about patient leaders and who they are, because patient leaders are really what makes social health possible. If this is a new term to you as well, I'll take a step back and say that patient leaders are individuals sharing their story or a loved one's story with the hopes of helping others. This research proves that the work that you're doing does make an impact, and it's really a big one. Patient leaders and individuals sharing their stories are able to help others feel less alone, have more information than they did when they were in their shoes, and then make changes within the healthcare system. We really consider each and every one of you here today to be a patient leader. You're out there leading the charge for patients across all sorts of different condition platforms. You as patient leaders are the heart and soul of the community, and you help others by sharing your advocacy efforts. So what is social health? I know AudreyStephannie mentioned it before, but I'll say again, we define social health as the dynamic real-time actions people take to find meaningful connections and share information throughout the health journey, ultimately leading them to better health outcomes. The term might be new to you, but the concept is not new to anyone on this call. In fact, the concept is something that each and every one of us and you are partaking in every day. So how do we know that? We found through research and educational campaigns to our network for this to be true. So over the last few months, we've launched an email campaign aimed at educating the network on the power of social health. And we received an overwhelming amount of patient leader definitions for social health. And as our social health education campaign continued, our research findings only solidified the impact that patient leaders like yourselves have on the overall community and social health. As a network, our goals, benefits, and strategy all revolve around optimizing social health and empowering patient leaders. But as individual patient leaders advocating for your respective communities, there are several ways you can use social health to help. So to describe social health, we want to share 3 reasons why patients and caregivers are using social health, which will then easily translate into how you can make the most of social health and amplify your advocacy efforts to increase your reach as an advocate. Next slide, please. And I'll turn it over to Sarah at this point.
Thanks, Kristine. So reason number one, patients and caregivers actively engage in social health. So they're using social health every day, and it's such a valuable resource for everyone. So if we go to the next slide. So as we know, patients are constantly seeking connections and opportunities to discuss their shared experiences living with a health condition. And this is relatable content that helps foster this engagement. In fact, results from a recent social health survey that Health Union conducted in 2021, which was completed by more than 2,300 people, show that 95% of patients use online health social resources for health reasons. This is the first of several data points that we'll be sharing throughout the presentation. So if we go to the next slide. So meaningful interactions drive higher engagement. While we know relatable content provides opportunities for patients to connect, content alone really doesn't provide a sufficient experience for an engaging online health community. So this is where, as a patient leader like yourself, has the power to help increase engagement in the social health area by sharing your own experience. As you can see from the chart, the average Health Union online health community engagement is significantly higher than the average online Facebook engagement rate. So online health communities are able to achieve this level of engagement because they focus on social support, engagement, and active moderation. Essentially, online health communities provide a level of comfort and support that people may not have otherwise in their day-to-day lives. You can go to the next slide.
So moving on to reason number two, social health provides information, connection, and validation at the right moment. Next slide, please. So in our published analysis, we found that validation, empathy, and understanding play a truly significant role in meeting people where they are. We analyzed Facebook comments across 6 of Health Union's condition-specific communities, and of all the comments, 58% were expressions of social support. And of that 58%, nearly half were comments validating the knowledge and experience of others, and a third conveyed empathy and understanding. I'd be willing to bet that many of you listening today can totally relate to this. How many of you have felt validated when you see others sharing their stories that are similar to yours? Or how many of you have received messages from community members expressing gratitude for you sharing those moments and experiences with them? Patients and caregivers are looking for information and validation, and this has really proven to benefit the community overall. Next slide, please. So as a patient leader in the space, you know firsthand how impactful it can be to share resources about your condition and your journey. In our survey, when we asked patients and caregivers, when asked what patients and caregivers have been able to do as a result of using online resources, people shared actual tangible and emotional outcomes. Social health has helped people living with chronic health conditions to better understand their condition, to better communicate with their doctor, to feel more informed about their treatment options, to feel smarter about their condition, and honestly, and I think most importantly, to feel less alone. So I ask you, can you think of a time that you used information you gathered from an online source, or perhaps a patient leader to help you one of these buckets? This really proves others are doing this too. Next slide, please.
So reason number 3, social health guides treatment discussions. If you go to the next slide, please, Rita. So people engage with social health most often during critical decisions in their treatment journeys. Patients reported using online social health resources when finding or learning about new medication or treatment options at the time of their diagnosis or a loved one's, and when starting or switching to a new treatment. These numbers indicate how important online health resources prove to be for patient outcomes. And I'm sure some of you listening today can think of a time during your own journey when you use these social resources when looking into your loved ones or yourselves' treatment options. You can go to the next slide. So more than 8 in 10 people will utilize the information gathered online in conversations with an HCP. So the data from our social health survey shows this, that 80% of people are likely to talk to their HCP about a conversation that they had online with a fellow patient leader, which is pretty awesome. So I'm curious if anyone here has learned anything, has learned something online that they then brought up to their doctor, such as a new medication they wanted to try out, or an unusual symptom that they've been noticing, or even like unusual side effects. If you've ever had this experience, feel free to share it in the chat. We would love to just see your experience as well. And then on the next slide, community interactions create space for decision-making. So as we all know, living with a chronic illness can feel extremely isolating, which is why we feel that online support is essential. These community interactions we've spoken about create space for better decision-making, which more often than not lead to improved patient outcomes. You can go to the next slide.
So we know that was a lot of data, but we feel it's really important to share because it truly showcases the power, showcases the power that each of us holds to help other patients and caregivers. So now that we've talked through how others are using social health, we want to show you some real life examples of patient leaders within our network and how they're helping to cater to those 8 and 10 people who are going online to find information and have conversations with our HCP. Next slide, please. So as we mentioned previously, thanks in part to patient leaders like yourself, 86% of patients better understand their condition, and most importantly, 62% of patients feel less alone based on information that others are sharing online. So in thinking about the content that you post online, think about what might have helped you communicate better with your doctor, and what might have helped you feel more informed about a treatment option, or what might have helped you feel more confident and knowledgeable about your own condition. So these 2 examples on this slide shown here are ways that patient leaders have stepped up to provide support to patients and caregivers in the moments that have really mattered most. Brooke and Amber are 2 IBD patients who realized that the need to help and support mothers who have IBD is critical. They launched IBD Moms and have created an incredible platform, dedicated to this community. So Kristine on this slide, who some of you may know, is a powerhouse when it comes to the rare disease space. She's used Clubhouse to create welcoming and impressive space for those who want to connect over their own shared experiences. All of these leaders have tapped into their life experience, the professional skills that they may bring to the table, and have created supportive platforms for others in their own way. Next slide, please.
So here are a few examples of patient leaders who have spoken out about the need to improve the patient-doctor relationship. Vicky, who's a contributor on our psoriasis community, wrote an article about the relationship she has with her doctor and how she navigates difficult conversations. And then Ilana, who you'll see on our panel later today, is phenomenal at putting out social health content. She shared this reel that she created on how to advocate for yourself as a rare disease patient leader. Next slide.
The patients and caregivers are looking for information to help them make effective health decisions. Many of those decisions come down to getting a diagnosis, starting or switching treatments, or just learning more about their condition. 2 examples here are Dawn, who is also a contributor at Health Union. She created a space on Twitter for members of the chronic illness community called Spoonie Chat. This Twitter chat brings together members from all over and discusses different topics related to their patient experience. So many of the members walk away with information that they didn't have before. And then Jerry, who's another amazing patient leader, uses Instagram Reels to show the realities of living with pulmonary arterial hypertension. Her content is honestly so relatable and so energizing. She really takes the approach of sharing out the day-to-day life with her own personal experience with treatments, clinical trials, and symptoms that patients and caregivers should be looking out for. Next slide.
So supporting patients in their health journey. As we mentioned previously, this data shows that patient leaders are supporting individuals across the entire continuum of care. From diagnosis to management, our research reveals that some common ways patients and caregivers leverage social health to understand test results or learning about new treatments. So 2 examples I wanted to share with you are how patient leaders are filling in information for these points. So here we have Damien, who has publicly shared getting infusions. He has a YouTube video on this, the expectations, the challenges, and questions that others should be thinking about before they go and receive this treatment. He's also just very personable and fun and nice to listen to. So I highly recommend checking it out. Candace actually used an off-label medication to get her ITP in remission. So she shares her journey and clinical data that has helped encourage other ITP patients to talk to their doctor about trying similar situations. Patient leaders, as I'm sure you all know, hold so much power when it comes to social health. They're the driving force behind another patient or caregiver not having to face the challenges and isolation or a lack of knowledge that others have had to face in the past. Next slide.
So now what? How can you tap into social health to help amplify your own advocacy efforts? The great thing, honestly, about patient leadership is it's not a one-size-fits-all thing. So whether you're just starting out or if you've been advocating for years, you can take your own path to advocacy, and it can look different for everyone. We hope the information that we showcased can at least get your wheels turning, and that it shows you how important your own story can be. It can really be life-changing for others in the community. You'd be surprised at the impact that you can make on a single person or many people just by sharing your own story. So we've outlined some ideas here on the slide, and we will be sending this information to all of you after this panel discussion, so you don't have to write down all of these links link out to some potential additional resources that you can use. Next slide. So at Health Union, we are experts in social health with over a decade of knowledge in the online health community space and beyond. If you're not already part of the Social Health Network, we invite all of you here today to come and join us. We're all leaders from across condition areas. We're all working towards the common goal, and that's to help improve health outcomes for patients within our communities. There's so much to learn and draw upon from each other, and so we'd love to have you. And that's it. I think we're moving on to our panel discussion now.
Yes, thank you, Kristine and Sarah, for that great panel discussion, panel presentation. We will be moving on to the fireside chat in which Ilana will be joining us. So please feel free to share any questions that you guys have or had throughout the presentation in the chat or the Q&A. If not, we also have some questions here. I will give people a couple seconds to write their question if they do have one. But in the meantime, the first question that I have is often people's journeys. Like, how did you guys find yourself into the social health world? And what is your experience being there, either as a patient or working for Health Union?
I guess I can start. I'm Ilana, Jacqueline, by the way. Hello. I'm an associate director with Health Union as part of their community team, and I'm a rare disease patient leader. And I've been in the patient health, social health community for as long as it's been around, I think. And for me, I thinking back, there's so many different ways that I kind of snuck into the social health world without even realizing that I was in it. But social health has really meant having an accessible community for me, which is something that's not always widely available for so many patients. And as someone with a chronic illness, disability, whatever you want to call it, there are parts of life that can be so isolating, especially in areas of support. And when I think back to the very first day of my diagnosis, I'm being rushed to the hospital, and what am I doing? I'm on my phone. I'm looking at the message board of my disease's nonprofit organization. And that, that two-way lane to ask questions, to see the experiences of others was everything. I use social media and the connections with other patients that I've made through it as a lifeline. And I get second opinions on what to do about treatment and how to cope with all that, all the indirect ways that that chronic disease impacts my life. And now I also have the opportunity to offer that support to others and show that, no matter how rare or unique the disease is, so much of the patient experience is really universal. And we can find a lot of solutions for unnecessary ways in which we struggle by sharing those experiences, and sometimes just illustrating how common they really are.
Yeah, thanks, Ilana. I can speak on behalf of the cystic fibrosis community. So I am a community manager for the CF community at Health Union. And I constantly just see community members discussing unusual symptoms that they've noticed and tips that they maybe have brought up to their care team that they might not have, heard from otherwise from their doctors. And these organic conversations have really led to patients feeling less alone, but also improve their emotional and physical well-being. So we, let's say we post an article or publish an article, and we might get comments saying like, oh, I didn't realize this was connected to CF. And I'm sure, that's similar to other conditions. And I think just sharing that information has been so useful, not only in just sharing your own story, but having helped people who maybe have not yet been diagnosed or just recently diagnosed. So I just think there's so many useful resources out there, and connecting with people can do so many incredible things for each other.
Kristine, would you like to go, or would you like me to move on?
I'm not sure I can add anything too meaningful to that, but I will say, so I'm not a patient advocate myself, but I've been with Health Union for quite some time. And when I started off, I was managing our community for folks with multiple sclerosis. And I think the work was just, it struck me how meaningful the work is to be able to interact with people going through such a life-altering diagnosis, and the impact and meaningful differences that having a community for people who can find others going through their experience, like what a difference that can make for them. I remember early on, one of our amazing patient leaders wrote an article called "The Perils of Showering with MS," and it's such a very specific topic, but it just really resonated with the community, because the way that Devin had written his article, it was so relatable in the heat impact and the slippery floor of a shower, and how that experience is so different for people who have MS versus folks who may not have a chronic health condition at all. So my journey at Health Union and connecting with patients who have shared their experiences and made a difference has truly, honestly made a huge difference in my own life. And I'm just blown away every day by the power of community. And it's just so amazing that community can mean so many different things. And that the fact that online communities really make a difference in people's lives is just amazing to me.
Yeah, thank you guys so much. Thank you. So I think last time I checked numbers, there are 25 to 30 million people living with rare diseases or a rare condition today in the US. And part of what we're doing at the Coordinating Center for the Undiagnosed Diseases Network is trying to find a way to create some sort of training for medical professionals when they are faced with a patient who might be dealing with a rare disease, right? Or a condition that is maybe not rare, but is presenting in a very unusual way, right? And so the reason why I'm bringing that up is with 25 to 30 million people, I think there can be a scale of injustice sometimes, where these patients have to become the patient advocate. They have to become the patient leader. They have to go and do the research and then present that to the professionals, right? And so I guess my question to you all is what is the spectrum, right? Because maybe someone might not have the time to dedicate time, like for a blog, that might be all consuming, or to become an influencer to a certain extent, right? So what is the spectrum in which people can actually still be able to be a part of this community, whether it's just to be participants in the first, few years, or to stay there if they desire, or is there, what is and also on top of that, what are the pressures of becoming this leader if you might be N of one or N of very few who are faced with a rare condition?
Wow, that's a great question. And I just want to go back and say that exactly as you described, there is this horrible pressure for rare disease patients where they do have to be the doctor, the researcher, the advocate, and the patient all at the same time. And that is incredibly stressful. And nobody trains you for that. You don't wake up and go to school to become a rare disease patient. You are expected to, learn how to survive in this world that is not built for us. And so it's definitely a spectrum of getting from kind of being like a lurker in the community. And we see that a lot at Health Union and across all of our communities, that we have a lot of people who read the articles and, they're clearly looking on the message boards and things like that, but maybe they're not contributing just yet. And that's perfectly fine. There's a learning curve. There's definitely a period of time where what you need to do to survive is just absorb and look and read and see all these other people and what their experiences have been, so that you can start deciding how you want your experience to be. And later on, if you kind of become like a veteran rare disease patient where you've gone through the system, you've gone through these experiences, you've had the classic medical gaslighting in the ER, then you can go and you can share your experiences in whatever way you feel is going to be most impactful. And there are so many ways to do that. That can be as simple as answering questions on message boards, or it can expand to writing articles, or it can expand to writing a book, or going on social media, or being in documentaries. I mean, it's absolutely endless the ways that you can contribute if you feel like you have the time, energy, and space to contribute. And that's not required of you. All that's required of you is to be there for yourself through an extremely difficult journey. But certainly, if you have the capacity to do so, sharing your journey along the way can be so helpful to so many.
That's so good. Thanks, Ilana. So we had a question come in, and the question was, and I think you referred to it in your answer, Ilana, about medical gaslighting, right? Whether it's the doctor might not believe you, or they're telling you that is not what you had. One of our patients over the other day was telling me that, she brought her son in, and the doctor literally said, the last thing I learned about mitochondrial diseases was my first year of medical school. I don't believe they exist, right? So just absurd stories like that, right? So how do you deal with that? And how do you equip and arm yourself for the potential of medical gaslighting, if that's not a term we're coining it today, right? But yeah.
I mean, it's not even a potential, it is assured. It is assured that if you have a rare disease, you're going to experience that. And that is something that I've thought so much about, and I put a lot of content out there on how to have those conversations, whether you're in an exam room at a doctor's office or you're in the emergency room and you're experiencing that, because those are the two main places. But yeah, I mean, patients are definitely going to run across doctors who just haven't heard of their condition and therefore don't believe it exists. They'll try to reverse that diagnosis into something that's a little simpler and easier for them to consume and treat. And that's not what they should be doing, because that is completely unhelpful to the patient. So there are several ways to fight back against medical gaslighting. And again, it goes back to that patient really having to be the researcher, the doctor, the advocate, and the patient at the same time. You really have to come in armed with, everything about your diagnosis. So for instance, when I go to the emergency room, I literally have, it's not a binder, because you can't even expect them to read a binder these days. It is a presentation deck. I am opening it up and being like, this is my disease. This is what you need to do. This is the things that you cannot do. Very simple bullet pointed things to make it easier for them to digest, which is horrible. We should never have to be put in that position, but realistically we are. And as part of our survival, that's just kind of how we have to let it play out. If you look on my TikTok or Instagram, I post a lot of reels about the language that you want to use when you're in a situation that involves medical gaslighting. So it's things like, just kind of repeating back, like, these are the symptoms that I've told you that I have. These are the tests that I'm asking you to run. Can you document the refusal to run those tests? Just so I have that in the file. Because more often than not, they're going to have a really hard time defending the actions or lack of actions that can put you in real peril, or put your children in real peril. So being able to document that, kind of summarize what is happening and put it back on them. And then it's also a matter too of, if you have the capacity to do so, sometimes just walking away from these kind of doctors who are not believing you when you have, it seems so silly when you're in that situation, because so many of these rare diseases are undeniably real. Like it's right there on the blood test, it's right there on the CAT scan, it's right there in your whole genome sequencing. It is undeniable, but they will deny it. And if you find yourself in a situation where you're not in a crisis, which is not always the case, but if you find yourself in that situation, if you can leave and find another doctor who's going to treat you with the respect and dignity that you deserve, that's always the better option. And try to remember too, that you are seeing one doctor in one medical facility in the expanse of the entire country. And he may or she may have been the one to graduate at the bottom of their class, and may have been the one who didn't get the education that they needed. And there are so many other wonderful, willing medical professionals out there who will work with you. And I'm sorry, but I know it does take extra effort to go out there and find them. It's not always easy, but that unfortunately is the situation right now. It's wonderful that there are programs that are working with medical students to make sure that they get this education, so this problem becomes less and less basic and what is happening over time.
Mm-hmm. And that's so important. I think oftentimes, because the medical profession can be held to such a high esteem, and sometimes it is necessary, right? But we forget that we are paying them, right? Like we can fire our doctors, right? And I do like that idea of, if this is not serving me, I don't have to stay, and I can go somewhere else that will actually treat me like the whole person that I am, So I think that is very important. I think we have time for one or two more questions, so please keep them coming. And here I don't see any new ones, so I will go ahead and ask another question. I think another curious point for me is how do you know what to say or what not to say about your, within social health, right? So while it is important, I think, for everyone to hear rants about medical gaslighting, what is something that you would not share, or just, I guess, what is that boundary, and how do you approach it?
Sarah, do you want to jump in on this one, or do you want me to go for it?
I'll let you start, since you have the most experience with this.
Okay. So I have no boundaries. If you follow me on social media, you're going to see that I'm quite comfortable sharing pretty much everything, which is probably not the norm, but my life is an open book. And you're always going to get way more than you bargained for when when you're looking at my social channels. But it's an intentional overshare. I used to limit my social story just to, the suffering, just the really hard parts of being a patient. But my story is so much larger than that. I'm a 32-year-old rare disease patient who beat the statistics and got to adulthood. And it's not easy, but this is what it can look like. It can be, talking about my marriage or a weekend at the farmer's market or a nervous breakdown in the waiting room. And, I want to give a very holistic sense of what it means to be a modern patient living in a world that maybe isn't always built for me or people like me. And representation, it's important. It's not always pretty or flattering or optimistic, but optimism isn't always the point. I think, the point is social health can really be the tool we use to obliterate isolation. And it's hard to feel lonely or shamed or hopeless when you see you're not really alone in this experience.
Sarah, did you want to add to that?
I completely agree. I mean, I think, of course, people share what they feel comfortable sharing. So like, hey, you never have to share anything that you don't feel comfortable with, right? So like, there's always going to be people like Ilana who feel really comfortable sharing things about everything. But if you only feel comfortable talking about one or two things, then that's totally fine. Like you don't have to be someone who talks about everything, or you don't have to be someone who talks about something else just because someone else is. I think, you talk about what you feel is meaningful and people will appreciate that. And ultimately, you're always going to be helping other people and also just helping yourself. I'm sure for Ilana and others, it's really cathartic being able to talk about your experience and knowing that there's other people on the other side who have dealt with similar situations.
And I think too, we see a lot of patient leaders use pseudonyms who go online and they are sharing very personal details, but they're doing it under a name that is not theirs, so that they can have that personal privacy. Because we do see a lot of patients who are they're embarrassed or ashamed. They just want their privacy, especially when it comes to certain diseases, and that's fine. That's perfectly fine. Any way that you choose that makes you feel comfortable, just like Sarah said, if it helps you, if it's cathartic to you, if you feel it will be helpful to the community, then that's the right way to do it.
I also think it's important to recognize that, if you're someone who is sharing your story and you don't feel like you're getting a lot of interaction like publicly in whatever form you're sharing that story, that doesn't mean you're not actually making a difference, because we have tons of lurkers who just really want to read and they feel less alone by hearing your story. And the more real you can be, the bigger of a difference that you're going to make. So those lurkers who aren't interacting like visibly online, they're probably talking about it at the dinner table with their family or taking those conversations to the doctor's office. So much of the impact that patient leaders are making is not even something that you can see in the real world. You really have to get to know people. So I think it's hard to remember that sometimes when you see people with a ton of followers or a ton of engagement on their posts. That makes a huge difference, but you can make a difference in other ways too.
It's true. It's true. So another question that we received is, someone doesn't feel supported in their specific disease community. And the question is, should they force themselves into another space or look for support from others with different diseases? I guess, what are you guys' your takes on that approach?
I can start with this one. So one, I'm sorry you don't feel supported in your community, but there are so many other communities out there. And even if you don't have the same condition as someone else, a lot of what you go through is similar situations. So whether it's with your doctor or with health insurance or, being in public or something, I think there's a lot of overlaps in other communities. So I would say definitely look into other communities, but maybe even if you feel comfortable to start sharing and posting in that community, and maybe others will kind of follow the lead. You know, I think there's so much that people can do, even if it's just like baby steps, you know, like you don't have to have a blog or an Instagram or TikTok to be an active patient leader. You can just talk to people, talk to family members, talk to friends, kind of get the word out and feel support there. But I definitely think that speaking with other people in other communities can be just as helpful. So I would definitely give that a try.
Any other thoughts?
I think that pretty much covers it. I mean, I think there can be, I've seen it in certain communities, there can be a lot of toxicity in certain disease groups online. And one, know that it's usually bigger than just that group that you're seeing online. So if you want to kind of start your own area for that, don't be afraid to do so. And always, of course, look around and see what already exists. And then think too, like, just because your disease is one specific disease, there might be larger like categories of support. So if you have, you know, ankylosing spondylitis, you might go into the autoimmune general support groups, or if you have Parkinson's, you might go into the larger, you know, neurology support groups. So sometimes you can kind of like go up and branch out in that sense. And then of course, rare disease has just a billion different ways you can go for support in so many different groups. So if you're not finding the support you're looking for, I would say, like, don't force yourself into a space that is not supportive, because what does that do for you? That doesn't help you in any way. So find your best fit, or go out and create it.
I like that. And I also really like the approach of real life. I know that, contrary to my age, everything seems to be very much like social media, but I do think there is so much power in just having a conversation with family members, right? I know a lot of our patients, especially like our patients who have children, or parents of our patients, just getting them comfortable with the fact that maybe their niece, their nephew, their grandchild is struggling with something that they've never seen before, right? It can be very helpless, right? And so sometimes that social network can actually be within your own family structure, and how building that support would be important, because they're the people you will be around more often than the people that you probably interact with on social media. So I think that is also important to make sure that people know about. We have about 3 more minutes. So again, one more question, I think. But if no other questions, I do have one. So, I mean, specifically from Ilana, it seems like, again, that onus is on the patient, right? To do all of these things. How do you support, like, where do you find support outside of, or maybe if you do find support within this, just to help you get through, right? Like, not necessarily just, okay, like I need support to validate my feelings, because they are validated, but just to continue, right? Like, outside of the realm of just being a rare patient, who just supports Ilana, and how do patients find that in general, especially if they're being thrown into these leadership positions, you know?
Yeah, no, that's a great question. And it's funny, because it is another one of those things that support for yourself is an intentional find. You have to really go out there and figure out, like, who is going to be understanding and who's going to be, it's hard, because you're going to find people who are kind of on the fringes of what you're experiencing, and they're going to approach you with not empathy, but pity. And that's backwards for what you need often. So for me personally, one thing I cannot recommend enough is go to therapy day and night. It's not because anything is wrong with you. It is because it is a stressful situation to be a patient with a rare disease or a chronic illness. And you do need that support. You do need that, emotional support, and you need someone to help you strategize. how you're going to micromanage all these feelings and situations and medical PTSD that you're probably going to experience. So therapy is a huge suggestion that I'd put out there. But I also have a wonderful husband. My mother is great. They're both advocates in the community as well. And then again, there are so many websites like our own Health Union communities. Sometimes for me, just going ahead and reading through different articles just makes me feel, again, pulls me out of that sense of isolation, makes me see that my experiences, while at times feel so stressfully unique, like nobody else is going through these things like I am going through them. Because if you're thinking about your life in just the general world, and you're looking at your neighbors, your friends, other people in your family who don't live with these challenges, you just feel extremely isolated. But if you put yourself in a different group and you look at your community, you realize people are living, like they are out there with the exact same circumstances as you, and they are finding ways, and they're having breakdowns, and that's okay too. You can have those. But knowing that these communities online, having mental health support, and then I've also just having been a patient leader in the community, I work so much with patient leaders in every capacity. And we have, I mean, I get DMs all day back and forth where we're, just discussing everything that we're going through. And again, it's helpful because I do go on my Instagram stories all day and just like all the drama that I'm going through, I put out there so that people can see like, I'm not alone, you're not alone. And we have that dialogue. So that's been really helpful for me. It's one of the reasons I do encourage people to, if they feel comfortable with it, go on social media and share, because you can find so many people who are going through what you're going through. And I think that's one of the pillars of support that I just can't rave about enough.
No, that's important. And I guess one more slightly connected question to that, to both Kristine and Sarah, is as people who might not necessarily be struggling with a rare disease, how do you, in a sense, control your empathy, right? If you're, especially like, Sarah, you work with cystic fibrosis, and you probably are receiving, many comments or text messages or however they communicate with you about their specific conditions. How do you then control that while still giving support to them, but then also not necessarily letting the onus fall on you, if that makes sense?
Oh, that's a great question. Yeah, I mean, it's hard. Definitely there's times and comments that I'll see that I'm like, this is a lie. And as an empathetic person, I'm sure a lot of us here are empathetic people. It can be really tough, and you want to just like reach out and like hug someone, but you're on a computer, and so you can't really do that. So you kind of just like respond in a loving way, and you think about what they're going through. And I know that I can't relate on their level. So what I try and do is share resources. Maybe like there's an article that could be something similar that they're going through, or there's a forum page that, they mentioned that, like a topic that they mentioned, or a story that someone else posted. That's where I'll go in and share those forums or stories to kind of like help connect that and help fill that gap, because I know that that's what they're looking for, and that's what's really valuable. We also have patient leaders who write articles. And so sometimes I'll reach out to them if they've dealt with a similar situation, and we'll say like, hey, someone, in our community is dealing with this. I know you've gone through this. Would you be willing to just like chat with them or have a conversation? And they're more than likely to, respond and have a conversation with them. But as Kristine mentioned earlier, I definitely look at people differently and just like have more empathy for other people. And while I'm not going through everything that like, a lot of you are, I like try and, be in your shoes and try and like understand from your perspective. And I've just learned so much from all of you and have so much gratitude and so much like appreciation for everything that you all do. And especially the CF community, so many caregivers and moms and dads and grandparents and spouses and everything they do. it's just incredible. So yeah, there's a lot of empathy there, and just kind of like taking it one day at a time with all of those conversations and stories going on.
I totally agree with everything that Sarah and Ilana have said already. And, you know, I think at times, you know, I'm also like a very empathetic individual, and it's heavy. There's a lot of heavy discussion. And I think whether you're someone who is actually experiencing the things that you're reading online from other patients, or if you're someone like myself who is like more of an observer, but a support provider, I think everyone needs like screen breaks, to be honest. And like to echo what Ilana said, like therapy. I think everyone has heavy stuff going on, whether it's, you know, some obviously have more than others, but I think empathetic individuals especially need to make sure that they take time for themselves to fill their cup, and whatever that looks like. It could be just participating in forums that are about like fun things, or, you know, reading a book or taking a walk. I think self-care continues to be important for everyone, and breaks, especially screen breaks, are really great.
Yes, I support everything. So I just want to thank all three of you, phenomenal. And I truly enjoyed just leading this panel / fireside chat. But we're going to be turning it over to Cheyenne Walmsley.